All right, welcome back to Daybreak on this 7th day of April 2020. But somewhere in the world, it's still on the 6th of April 2020. It's still Monday. That is in New York, where we're crossing over to speak to Dr. Waafa Sadr, who is joining us from there. Of course, she is the director of ICAP at Columbia University. And good evening, or is it good night to you? How are you keeping?
Very well, thank you. Good morning to you.
All right, and thank you so much for making time for us to join us from New York. And we are focusing on New York specifically because so far we understand that the United States of America has, excuse me, a total of 367,000 infected persons, that is infected with the coronavirus. This is after several tests that have been conducted to the tune of 1.9 million, but 131,000 of those are in New York State. What has led to this very exponential increase in the numbers in New York that has now become sort of the epicenter of the United States?
I think what happened in New York is a lesson for how one needs to act very fast in order to prevent it from happening somewhere else. Unfortunately, as you know, this virus is very stealthy and it's very highly transmissible, meaning someone who has COVID-19 is able to transmit to several people, and this results in amplification of the transmission and making it very hard to contain the virus once it's transmitted at a high level in the community. So I think the lesson from New York and other communities like New York is that it's really important to act very decisively and to put in place very strong measures from day one, so that the virus can be contained and transmission can be minimized as much as possible within a population.
And of course, you benefit from having very many scientists who are able to study the infectious diseases. How did it happen that despite all the knowledge base that you have, you're also able to observe what was happening in China? How did it happen that you are not able to stop this before it could spread to the numbers that we have now?
I think part of it has been because of the nature of the infection itself, and partly it's been because we've put in place incremental measures, which means that because it's so highly transmissible, and I think because measures were put in place one at a time, incrementally, to prevent the transmission. For example, the social distancing, what you're calling a lockdown, for example. These measures were done incrementally and slowly, and I think that may have been, in retrospect, the reason why we're not able to stop the transmission early on in this outbreak. And therefore, I applaud what's happening in Kenya, in that the country is taking this virus and this pandemic very seriously and trying to put in place firm measures across the country to try to prevent transmission as quickly as possible.
And Dr. Sadr, how would you describe the state of battling coronavirus, specifically in New York, but then again also looking at the entire country? How much of progress have you made to stop or to slow down the new infections?
I think we've been making slow progress. It looks like over the past few days that we may be seeing the light at the end of the tunnel. There may be a plateauing of the daily new numbers of cases that are being reported in New York City. This would be very good news because this would mean that hopefully we'll be turning the corner and then we'll be able to control the outbreak here in the city. But of course, this has meant that for the past several weeks, we've had in place recommendations for people to stay at home, avoid going out except for essential services. We've also had very strong recommendations for social distancing, working from home, closure of the schools and universities, and so on and so forth. So I think all of these measures appear to be having an early impact now that we're beginning to see, which is really good news.
Right, and of course, good news that everyone would be happy about. But when you look at the cases that you're reporting, I look at the numbers on worldometers.info, and they are saying that in the US, the serious or critical cases that you have are about 8,800. Generally, how are the people that are positive with the virus? How are they depicting the symptoms, and how are you seeing the progression of the disease?
I think the good news is that, or fairly good news, is that most people who get this coronavirus will have a mild or moderate illness and usually will recover by themselves. And that's the recommendation now in the US and elsewhere, is that with mild to moderate illness is to stay at home, but to isolate oneself. So to stay away from contact with family members and loved ones, but there's no need for hospitalization. However, in a minority of cases, about 20% or so, the symptoms will be severe and they will require hospitalization. And then an even smaller percent, about 5% or so, they will require critical care. So we're hoping that as much as possible, people are diagnosed early, and that if they're diagnosed early and they're not very sick, that they're able to self-isolate at home, which is very, very important, and stay away from others within their community for at least 2 weeks.
All right. Of course, they have to keep their distance. When you said that most of the cases are not requiring hospitalization, what sort of pressure would you say this has brought on the health system of the U.S.?
It's been has had a huge impact on the health system in the U.S. and in New York City, with many of the hospitals being incredibly crowded, and particularly with the large numbers of cases that require hospitalization, even require intensive care. It's put a huge burden on the emergency medical technicians. It's a huge impact on healthcare workers. And even in New York, there's been a call for volunteers, for people, physicians and nurses who've retired, for example. They were called back and encouraged to come back and volunteer so that they can contribute to the response. And the good thing is that there's been a huge response, not only from the city and people from the city, but also from people all over the country who have offered and have come and volunteered to come and help in this moment of need here in New York City.
All right, and then for the serious or critical cases, because a country that is reporting 8,800, it is the highest actually across the world, despite the fact that the numbers in the US are higher. How are you attending to these patients, even as you look at where they are distributed?
I think what we're trying to do now is to, across the different hospitals in New York City, there's been an effort to have a collaboration and cooperation so that hospitals are helping each other, whether they are voluntary private hospitals or public hospitals. They are trying to work together so that if one hospital is short of certain supplies, whether they be masks or whether it be ventilators, for example, that there's a sharing of equipment across hospitals so that they're able to take care of the patients that are coming to their doors. There's even been a lot of contributions from other states where they haven't been hit as hard as New York, that have also sent their equipment to New York to be able to manage the situation that exists right now. And I do hope that we'll see similar cooperation and so on across the world, because I think we are all one world and we have to look upon this as a pandemic and work together so that we can actually control this virus, not just in our own community, but also across other communities in the world.
Right. And Doctor, of course, from your experience as a professor of epidemiology as well as medicine, when you look at the new coronavirus, the death toll now stands at 74,000, which is has been increasing over the past few weeks. When you look at this, 10,000 of them are in the US. How would you rate the fatality rate of this disease compared to other pandemics that may have occurred in the past few years?
This new coronavirus is not only very highly transmissible, but it also can be deadly. And at best, the mortality rate goes between from 1 to about 3% or so, and that's pretty high. That means 1 or 3 people within 100 of every 100 people. This is much higher than, for example, influenza. We know that with influenza, the seasonal influenza that we get every year, the mortality is only about 0.1%. So it's 10 times, if not higher, many-fold higher than the death rates we've seen from something like influenza, for example. So this tells you the seriousness of this condition and the reason why prevention is so very important, because we still don't have specific treatment and we still don't have a vaccine. So we have to work very hard at prevention. Prevention is what we need to be focusing on now, as well as taking care of the people who are sick. But focusing on prevention is absolutely critical.
All right. And then when you look at those critical cases, because of course in Kenya we're starting to have very serious, very severe cases. And so far you have 6 deaths out of 158 people that are so far tested positive. We've had 4 recoveries. And so it's getting to the concern level that people are wondering, should you get to the critical level, what are the chances of survival? What has been your experience in the US and specifically in New York, the patients that slip into that severe level? Is there a chance of coming back?
Yes, I think the good news is that people who become very sick and even need ventilators is that many of them are able to, after they're supported by the ventilators, the respirators for a while, until they recover, they're able to get off the ventilators. However, there's still a very high mortality rate with such severe illness. But nonetheless, even people who are very sick, if they're able to be supported through the most severe phases of the illness, they have a chance of recovery as well.
All right. And so when you look at it, because people have been talking about efforts to flatten the curve, sometimes in certain countries it's not working. When you look at the US, it has actually gone very high over the past 2 weeks. What is your prediction of what we should be seeing in the coming days or weeks?
Well, I think the U.S. is a very large country, and I think the epidemic in the U.S. varies from one city to another city, from one state to another state. And when you look at the flattening of the curve or the curve itself, it also varies substantially from one city to another. So in New York City, we're hoping that we're going to hit the apex of the curve maybe the end of this week. That's our hope and our goal. In other cities in the U.S., like for example in the West Coast, like in Seattle, in Washington State, they've been able to actually, through social distancing and so on, they've been able to flatten their curve. So every community and every city in this country, in this large country, is experiencing a very different kind of epidemic, and I think each one is going to see a different timeline for when the flattening of the curve will happen.
All right, let's talk about the medical workers or health workers that have been at the front line of battling this disease. And from global statistics that we have is that at least 30% of all the infections are related to health workers who catch the virus while in line of duty. What would you say about the situation in the US, and what more can we do to ensure that they are safe, despite talking about the PPEs as well as the patients communicating early of their condition?
I think the best measures, as I mentioned, is that really to try to do prevention as much as possible, and for sick people to, like I said, to stay at home and socially distance or isolate themselves from others. I think in the healthcare context, having the right PPEs is absolutely critical because it's critical for the health and well-being of the healthcare workers, and they're very vital because they're in short supply. And if you have a high proportion of them that get sick and have to be isolated, then you lose your very important workforce. So I think a lot of the focus here has been on trying to ensure that the healthcare workers have the right equipment to be able to protect themselves, and that's I think is a very important priority for any country as they prepare to face this pandemic.
And Doctor, back here in Kenya, some of the health workers are concerned, and especially their unions have been saying that they need assurance, they need more assurance each and every day. What is the mood of the health workers specifically in New York, and how do you think we can boost their morale even as they get to the front line of this battle?
I think the concerns of the health workers are very real, and I think it's our collective responsibility is to try to make their work as safe as possible. That's very, very important, as well as to demonstrate appreciation for what they're doing. And I'm heartened to see that here now there's a strong feeling and strong sense of gratitude for healthcare workers. For example, here in New York, every night at 7 p.m. exactly, people step outside their windows and their balconies, and they start clapping and making music and sound and so on. And it's all in appreciation of the healthcare workers, because they are the soldiers really in this effort against COVID-19, and they need to be appreciated and they need to be protected, and this has to come both in terms of giving them what they need, the tools they need, but also showing them the appreciation and the security that they need as well.
And I know you're a professor at the School of Public Health here, that is in Columbia University, but are you able to practice now, and what exactly are you doing?
I don't practice hands-on myself, but I work with many people who do. And my role in public health is really to provide the information that's needed to be able to respond to this epidemic, meaning taking a look at exactly where are the cases happening, who's affected by the disease and who's not, and trying to identify new strategies and new approaches that can hopefully control the pandemic. So we work hand in hand, public health. We work hand in hand with the healthcare system itself, because you need both. You need the public health response, and you need the healthcare system to respond as well. And both have to work very closely together, supporting each other and reinforcing the messaging that comes from both sides.
And so, Doctor, as we conclude this, of course, like I told you, we have 158 cases here in Kenya, but out of those 4 have recovered, 6 have died. So we're talking about active cases at 148. Once upon a time, New York was at 148. What would be your word to Kenyans as you wind up?
I think my word is to take this very seriously. This is a very serious pandemic, and this is a very serious virus. I think we know how to prevent it. Take the prevention methods, the prevention messages to heart. Please practice them and do them diligently. And as well as, of course, try to observe also the population measures that are being put in place now in Kenya, the social distancing, the stay-at-home messages, and so on. It's very critical to take all of these measures together very seriously from day one, so that hopefully the numbers of cases in Kenya will remain low, and you'll be able to overcome this virus without having to suffer from a larger numbers of cases.
Dr. Waafa Sadr, thank you so much for speaking to us from New York, and good night.
Thank you, and have a good day.
All right, thank you so much. Of course, she's speaking to us from New York. She's the director of ICAP at Columbia University and professor of epidemiology and medicine at Columbia's Mailman School of Public Health. She's been speaking to us on the status of the U.S. and specifically on New York